Hi, welcome back to Rebel Health. I'm Dr. Ellen Vora, a holistic psychiatrist practicing in New York City, and I want to address a somewhat sensitive topic today, which is that there's so much focus on destigmatizing mental illness and encouraging more people to recognize that this is an illness like any other illness. Like someone could have a diabetes and need their medication, and someone could have depression and need their medication. And I want to say first that I think that this movement is driven by all of the right intentions. I think it's really a beautiful, heart-centered practice to want more acceptance and less stigma around mental illness so that people don't feel ashamed or afraid to get access to mental health care and don't feel ashamed or afraid to talk about their symptoms or their treatments. I agree with all of that, the intention of it. Where I differ is that I think that this actually feeds directly and perfectly into exactly what the pharmaceutical industry wants us to believe, which is that we are stamped with a genetic, inherited destiny or fate for, say, depression or anxiety, and that it's inevitable. There's no way around it, and it requires this medication to correct the chemical imbalance. But good news, you happen to live in the United States in 2018, and we have these companies that have developed cures or treatments for that in the form of antidepressants. And so it really feeds into this feeling of this is an illness, it's physical, you can't help it, and you have to take your medication. And I think that where we get it wrong is that I would never blame anybody for mental illness. And I don't mean to say pull up your bootstraps or you can help it, knock yourself out of this. I don't agree with any of that. But I do want people to feel empowered and recognize that none of this has to be a destiny or a fate. And we don't even really need to think about this as a genetic inherited chemical imbalance that needs to be treated with medication. I think we can think about it as a genetic vulnerability, right? If you have a strong family history for depression, there's a vulnerability there, but that's only a vulnerability. It's not a destiny, and it always requires environmental factors to have this actually manifest as depression or mental illness in general. And those environmental factors you have quite a bit of control over, and they're not high tech, they're not fancy, they're not expensive, they're not sexy. It's really just that you have to go to bed early and get enough sleep. You have to feed your body real food. You need to get a certain amount of exercise. You need some relaxation in your life, and you need good relationships and access to nature, fresh air and sunshine. That's kind of it. And I'm not saying it's easy to get all of that. Like if you can get all of that in your life, that's the holy grail. But do feel empowered that there's a lot you can do to change the environmental influence on whether or not you manifest with mental illness. And I think sometimes that emphasis on destigmatizing, it's a great thing. Do not stigmatize these illnesses whatsoever, but don't just say, now we've removed this stigma, go find yourself a good shrink and get on a bunch of meds. I think remove this stigma and learn the ways that you can empower yourself to manage your symptoms. Be your own shrink. So I hope that's helpful, and we'll see you next time on Rebel Health.